slide presentation. Okay, can you see my screens?
Yes, we can. Thanks,
Okay.
Dr. Owen.
Miigwech. Ludash uhat duasauk akwanda ayahat wushkitan nahat site cha ak ayahat chet hida ayahat. Good morning, good afternoon. My name is Mary Owen. I am a member of the Aquan tribe, the Thunderbird House of the Shark Clan of the Aquan tribe of the Tlingit people of Southeast Alaska, to be specific. I want to thank you all for inviting me here today. This topic is near and dear to my heart. I am also the president of the Association of American Indian Physicians, and earlier this year, or actually at the end of last year, we started a vaccine campaign recognizing that our community, which has a normal amount of mistrust given our history in this country, would have some hesitation, probably have some hesitation about the vaccine. So we started the campaign with all of us getting our shots and getting our images up on our Facebook pages, and have continued that, though of course the momentum has slowed down now. So I really appreciate this opportunity to talk some more about the vaccines and how important they are in our country. In addition to being part of the association, I am an assistant professor at the University of Minnesota Medical School, and also run a program to recruit more Native medical students, or Native students, into medical schools so that we have more of us, which as physicians in our workforce, or health professions workforce, which gets to why I wanted to go back and say that I went into medical school in large part because as a patient in our facilities, I realized there were not enough of us in the within the decision makers of our clinics and hospitals. So knowing that I needed to go back to school anyway, because I wasn't getting where I needed to in life, I thought this is a good place. This is a place where we're not represented and we need representation. And it'll also offer me an opportunity to give talks like this and to talk to our community in a good way. So applied to medical school, and I have to admit it was a very difficult process. There were times when I definitely wanted to stop and not keep going. I did, knowing that again, we needed us in these positions where we could impact anything that affects us, mainly our health, help run the Indian Health Service and our tribal clinics. Additionally, or no, not additionally. So I completed medical school and then went up to work for my tribe, picture of which is on here, in Southeast Alaska, where I worked full scope family medicine for 11 years. And after about 11 years, I delivered babies, admitted people to the hospital, took care of people in the clinic, everything that a family practice doc does for full service care. But after about 11 years, I got burnt out of being on call every 6th night, and was called by the University of Minnesota, asked to come. And I thought this is an opportunity to impact at a different level and teach people more about Native health and what the expectations are for our community and when you go in to take care of our communities. So that's what brought me here. This picture that's in front of you is a picture of the raising of the Wushkitan, which is shark totem pole in Hoonah, Alaska, one of our smaller communities outside of Juneau, Alaska, where I was raised. We took the ferry over there and helped the entire community raise up the pole, mainly because I'm part of the Shark clan. But what I like about it is this emphasis on community. See how many people are involved in the process. And Roxanne Dunbar Ortiz, a historian for Native people, she wrote Indigenous Peoples History, tells us that what has kept us strong is our ability to continue to tell our stories. I think she's right, but I think it's also this coming together and the recognition of community before individualism that is unique. Well, not unique, but definitely a strong component of our values as Native people, and a shared value, I believe. As more evidence for that, this is a survey that was done in December by the Seattle Urban Health Research Institute, and I probably got their name wrong, but essentially they did a survey of over 1,000 Native people across the country, across 300 different tribal communities, asking them why would they get this vaccine, and they also asked them, if you do get the vaccine, why would you do it? And 75%, we always hear that we heard that Native people were not going to be getting the vaccine. Well, 75% said indeed they were. And more importantly, 75% said they were going to get the vaccine because it was important for their community. So again, going to that importance of Native people putting community before individualism. This is a picture. I have several images in here. I think I was just speaking with one of the organizers for the talk. And one of the problems that I see with COVID-19 is that, one, we've forgotten already, in part, how horrible last year and these times where so many people were dying at such higher rates, 3,000, 4,000 people a day. And also we forget the individual impact. So I wanted to include a few slides here. These are from the New York Times, so clearly we have permission to use them, about some of the people that were impacted by COVID-19. This is Mr. Aruka Juma. He's as you can see, is the last remaining male of the Juma people in Brazil. So once again, we're seeing amazing impact that we can't even quantify on indigenous communities. These were already spoken of in the very beginning, mainly mentioning, if you look at the slide at the bottom here, this is the mortality rate for Native people or indigenous people in this country, 3.8 times that of white folks as far as mortality. The incidence itself, how often we get the disease, is 2.2 times that of whites, but really it's this mortality rate. We end up dying. We're more often in the intensive care units and more often not surviving. This one really did me in as an Alaska Native, young Ms. Bufio. What's important about this, in addition to this young person, or to this amazing woman, is her young age. We have been impacted at younger ages than whites by this disease. And this is just a graphic showing the same thing, us indigenous people being the yellow bar on the very top. And I wanted to show you, there are going to be places where the impact is much greater, particularly those places where we have higher numbers of Native people. So Minnesota, you can see how much higher the impact is. These are, again, mortality rates for indigenous people versus whites, Asians, Blacks, and Latinos in Minnesota. Wisconsin, similar story. Michigan, higher population of African-American folks. And we have different rates. This is the COVID virus itself. What's important here, this is under electron microscopy. What's really important here are these little spikes you can see around the virus. And they're what our immune system is capturing and what our vaccinations are using. So this is a cartoon figure of the same thing. It's these little spiky proteins that are important, have become really important in our fight against this virus. Also important is this information contained within the virus. It's code. All of us have a code for everything. The way we move our hand, the color of our skin, everything in our body is coded. Viruses are the same way. This code talks about what the virus looks like and how it will function. Ms. Pino, 67 from Albuquerque. A teacher. It's also striking when you read all of those, just how much we have lost as far as contributors to our community, people who are doing things to help all of us. This is COVID-19 and how it spreads. So here's that spiky little virus again, and you can see inside its code. It attaches to once it gets into our body, it attaches to our cells. These are called cell receptors. And then the cell receptors help bring it inside the cell. So they breach this wall here, bring it inside. Once that sneaky devil gets inside of our cells, it starts to copy its own genetic code. Again, it opens up, copies its genetic code, sends that off. It also sends a message over to our cells to copy its outer protein, or its outer wall, not protein, its fat wall. And so it sends that copy that it's now hijacked our cell to make of its RNA, or of its genome, and the envelope that it also forced our cell to make covers it all up and sends it out on this way. And this happens millions of times in our body when it's been infected. Ms. Ramirez, 17 years old, from North Dakota. So this is a picture of, this is just from Wikipedia, and it's a very basic picture of the way that our immune system works. Basically, we have these macrophages. They're some of our early fighter cells, and they're always roaming our bodies looking for trouble, seeing where it's happening. They're our border defense, if you will, after our skin. And when they see an antigen, which these viruses or these invaders are called, they're called antigen, it grabs it, pulls it in, and then presents parts of it, breaks it down and presents parts of it to our main fighter cells. T lymphocyte, T cells, pick it up. They send the same message about what it looks like to the killer cells. Another T cell, killer cell goes out, starts killing those, anything that looks like this now. It also sends a message at the same time to B lymphocytes, B cells, and says, okay, we know what it looks like, start making some antibodies. And so the B cells start producing massive amounts of antibodies. So T cells out there, killer T cells are out there killing away, breaking it up. Macrophage again comes back around, picks up those particles, and from that also develops these antibodies. So we have two producers of these antibodies, one from the B cells that got the message from the T cells, and one from the macrophage that got the message from the chomped up cells from the killer T cells. So these antibodies go around looking again for this specific. Remember, our macrophage were just looking for any invaders. Now we know specifically what to look for. They're looking for these little spikies on the corona of the virus. And then they'll chomp it up much like here and get rid of it, and the macrophage will get rid of it even more. So that's our basic immune response. This little bar always gets in my way over here. So how do COVID vaccines work? They work by triggering that same immune response, mostly with the antibody production, so that someone who can have immunity without actually having had the infection. It's important that you know that none of the COVID vaccines used in the US have any part of the COVID virus in it. And I'll talk a little bit more about that in a second. So you can't get COVID from it. It is not live. None of the COVID virus at all is in it. 200 million doses of COVID vaccine have been given in the US. It's actually higher every single day, but we've seen few safety issues with either the Mrna or Pfizer vaccines. And we know that they have, and this answers one of the questions that I was sent ahead of. We know they're 94 to 95% effective in preventing COVID at all, and 99% effective in preventing serious COVID. So if you're one of those 5% who do end up getting COVID, we know that you will not get as sick as we saw people getting last year and into earlier this year from the virus. This, I just found, I was glancing at New York Times this morning to make sure I wasn't missing anything. And just this morning, they put out an article on how Pfizer makes the COVID-19 vaccine. I don't want to go through it here, but it's interesting. I know some people are curious about the process. Some are also curious about the ingredients. So take a look at that if you get a chance. I had it on here, but they make you want it. They want you to pay a subscription if you're going to show it to anybody. So I did do that. Ms. Black Horse, an aspiring leader in the Navajo Nation. All the potential we've lost. So specifically, how did the mRNA vaccines work? So remember that spiky protein. What we want to do, what the vaccines do, is they copy a piece of that code that I talked about that codes for the spiky proteins, spike protein. Using bacteria, as you'll see in that video of New York Times, if you look at it, they are able to hijack the bacteria and put that code within some of the message of the bacteria, totally inert, meaning it's not going to hurt anything, and then copy it into mRNA. It's called, mRNA just stands for messenger RNA. It's a copy of that original code, but it can be, that will be translated later. So it takes that copy, covers it with fat, so that it can be injected into us without dissolving immediately, and then put into a salt water solution, saline solution, and then injected into us. Once it gets into us, our cells pick it up, just like I told you, and they decode that little mRNA message to make these spike proteins, which then are put out on our cells. And as I showed you, the T cells recognize it and start the massive campaign against it. And that's what you're seeing here, that proliferation of these antibodies that have developed in response to these little spike proteins. Some people ask specifically about the Pfizer ingredients. So in addition to the mRNA, which again comes from the bacteria, it's put inside of a little bacteria to reproduce, and then it's copied to make the mRNA. And then that is encapsulated within a lipid shell. And these are all the little fats. I know these names look crazy and kind of scary, but they're actually just typical names for a molecule. And I remember in organic chemistry thinking, what in the heck is that? But it's just the way that we identify different molecules. Salts help stabilize the solution, and then sucrose does the same with the salt. So all of these guys are just balancing each other out so that it doesn't dissolve and it can get to where it needs to get. Moderna, they refused to do a little video like Pfizer did. I think they lost out. I think Pfizer got some free advertising, but in any case, like the Pfizer vaccine, they also have the surrounding fats. They have the mRNA, the surrounding fats, and salts and acids, all again, just stabilizers. So everybody's heard about Johnson & Johnson and how it was pulled, and we'll talk about that in a second. But the difference with Johnson & Johnson vaccine, or the vector vaccine, is that they take a adenovirus, which is a common virus that causes things like upsets, like stomach flu, other common illnesses. But this one is inert. It cannot get you sick, but they hijack it and put that mRNA code within it and then use that inert virus and inject that into us. And then again, the T cells are activated. These are, I wanted to put in this, it has those same ingredients that I talked to you about, but in addition, we now have the viral vector ingredients, and mainly it's just stabilizers in addition to that vector, that piece of the code that's needed to trigger the spike, to make the spike protein, which will trigger our immune system. So the Johnson & Johnson vaccine, people have heard about it now and heard that it was pulled. What happened is that a very small number of women in ages, what is it? I think we have it on here, 18 to 60, ended up getting some blood clots from low platelets. And you can see the numbers here. I highlighted it. 7 events per 1 million vaccinations among women 18 through 49 at a rate of 0.9 per 1 million for women who were 50 years and older. So very small number of women, but it's enough to make them, I think it really shows that our FDA system was monitoring closely and pulled that out of concern from lots of people, including scientists, that something was happening. But then they did enough investigation and realized the number was so tiny that it was worth, that the benefits of this vaccine outweigh the potential risks. So put it back on the market just, I think, in the last couple of weeks or last week. But obviously some women are still going to be concerned, and in those cases they might choose to have the Pfizer and Moderna vaccines. I know that I know a lot of people say that we should get whichever vaccine is available to us, and in some sense I believe that, but I also understand where some women would say, well, I think I wait for the ones that I know have no risk whatsoever. But remember how small these risks are. That's all I say. Reverend Wilbert Robertson from Roseland, South Dakota. The vaccine updates. So what we do know is that the vaccines are effective at preventing COVID-19, especially severe illness and death, the 94, 95, and 99% that I talked about earlier. We also know that even when we have been vaccinated, we continue to need to protect some folks in our community. And there are many people who haven't been vaccinated yet. So for those reasons, we need to continue with some of our prevention steps. And we'll talk more about those in a second. How effective, we still are learning about how effective the vaccines are against the COVID-19 variants. I just told you about some of the effectiveness, but we are not absolute on all of these. These are how much we think that they are working, how well we think they're working. We have some proof of it, but not enough to say, to solidly say they are 95, absolutely 95% effective. So we're going off of what we've seen so far. How well the vaccines protect, we still could learn more about how well the vaccines protect people with weakened immune systems or those on immunosuppressive drugs, like even steroids. How well COVID-19 vaccines keep people from spreading the disease. Early data shows the vaccines may help people from spreading the COVID-19, and I think I have a slide about that later for you. How long they offer protection and, the spreading, I'm sorry, I wrote that twice. Mr. Sasaka Moose from Prince Albert, Saskatchewan. We do have some information on how long the vaccines last. The reason that we can't state more is that they were actually that can't solidly state more is that they were only tested for 3 months. That's how long, we haven't had the vaccines around as long as we've had the illness itself. We do know from watching people who've got the infection that they have some natural immunity that lasts for about 8 months. We also know that the vaccine is more similar to the severe cases of COVID-19, which has given a stronger immunity to folks. We don't know, though, that stronger immunity necessarily equates with longer immunity. We think there's a good chance it's 8 months at least, if not 9 months, that you're protected, not the 90 days. But again, that still has to be proven. We do know that the reinfection is very likely to be milder when you do get it. Ms. McHorse from Santa Fe, New Mexico. And these just came out yesterday. Many of you have probably already seen these, but it's helpful because, as Native people, one of our strengths is being able to gather and support one another. I mean, it's lots of people's strengths, but us being community-based is particularly important. We can now visit with other fully vaccinated people indoors without wearing the mask or physical distancing. Remember, this is fully vaccinated people with other fully vaccinated people. You can take your mask off. You can visit with unvaccinated people from a single household who are at low risk without wearing a mask or physical distancing. So even more. You can participate in outdoor activities and recreation without a mask, except in certain crowded settings and in venues. You can start your travel again, and you don't have to get tested before and after. You don't have to quarantine after. There was actually a question in the questions about refrain from testing following a known exposure if asymptomatic, with some exceptions for a specific setting. So someone in the questions asked, can I go back to work if I've been exposed to someone, or do I need to quarantine if I've been fully vaccinated? If you are asymptomatic, you can go back to work. You don't need to quarantine. But there are still some restrictions for fully vaccinated people. You have to still wear well-fitted masks when visiting indoors with unvaccinated people who are at increased risk. So our folks who are still have high risk, like cardiovascular disease, strokes, immunocompromised folks, we still have to be careful if they have not been vaccinated. And you still should be avoiding large indoor gatherings. Oops, I'm sorry. And then you still need to get tested if you're experiencing COVID-19 symptoms, because even though it's only 5%, we know some people. In fact, I just saw someone last week in clinic who got sick despite being fully vaccinated. It's very mild symptoms, but still was one of those 5% who did get sick or did catch it again. Let's see here. Mr. Osceola, 70, Seminole member. And then the variants. Lots of people are having questions about the variants. So the variants are basically when a part of the virus is transcribed incorrectly or transcribed differently from the original. And so then all of a sudden you have a different virus, slightly different virus. COVID actually happens to be pretty good at it, has a good proofreading function, but once in a while it still happens. There are several mutant strains. I'll talk about those in a second. They all seem to increase the rates that people can get infected. They might decrease the effectiveness of current vaccines. That's yet to be seen. And now one of the reasons that we're on such a strong push to get everybody vaccinated is because of these variants spreading around the world. Until we get everybody vaccinated, these variants have more of a group of folks that they can pop from one another to, for want of more scientific words. This is Dr. Fauci's report just earlier this week, and he's talking about the different variants, which, for instance, the UK variant is covered very well. We do know that that one's covered well by the mRNA vaccine. Sorry about all these words. I thought I'd just cut through it for you. South Africa, it's not here yet. There's a small study that shows that the Pfizer was 100% effective, but again, it's small. J&J was only 64% effective. And then there's the Brazil variant. And we do know that there is good protection against this one so far from our vaccines. Ms. White from Yuma, Arizona. And I want to complete with this phrase again to highlight the impact that this has had on our communities. We all know that even though we had more the COVID virus impacted more of our young people than it did for whites. We also know that it still took a toll on our elders. About a quarter of those who have died were Native Cheyenne speakers. Our language, culture, and traditions is what makes us Cheyenne, but we're losing our teachers. How am I going to teach my son when I still have so much to learn? Indigenous communities are facing a cultural crisis that other communities are not. They lost 1% of their people when 50 people out of 5,000 died. And this I have from a different talk, but I always love this one, what resiliency looks like. This is my mom. I think it's really important to, I recently put together, I was part of a talk on honoring choices. And one of our speakers, another Native woman who works for Fond du Lac, said that, you know, we live in a different time. We don't have the same choices and options. And I think it's the same with these diseases. We're not, at one time when diseases might have hit us and we were healthier, we might have been able to withstand them with our natural immunity and our natural ways, traditional ways of medicine, but we don't live in that world anymore. We now, traditional ways have been disrupted. We're not on the lands we used to be, so many different ways that we are different from how we once were before contact. So in those instances, we do need to recognize that Western medicine is offering something that we couldn't, a way to help us that we might not be able to, because we're just not the same. We don't have the same strengths that we once did. We're strong, but we don't have those same sorts of strengths. Let me go to the next here. These are some of the questions that came through. I'm going to answer these and then we'll go to I see there are a couple, there's something in the chat and a Q&A question. So we'll go to those next. How long is the vaccine good for? We talked about the 3 months that we know for sure, but more likely closer to 8 to 9 months. We think that booster shots, you know, people are imagining, some scientists are imagining now that booster shots will be maybe once a year. Some people say once a year, kind of like the cold shots. Other people feel it'll go further out than that. So the jury's out. We still don't know. I don't think it'll be every 6 months though. It'll be, if anything, it'll be more like the yearly. Why would I get a vaccine where the benefits of the vaccine only last for a moment of time, 90 days? Again, we know that they're more likely to last longer than 90 days. What's the purpose of, if you can still spread the COVID-19? The chances of your spreading, once you get the vaccine, we talked about how your chances of it, we know, we don't have data to prove it yet, but we think that it's significantly lower by getting it. Also, you're protecting yourself. You will less likely get super sick and also less likely to get the virus in the first place and therefore not be able to spread it. If you have 2 shots, why are you still required to wear a mask? Because there are 5% chance that you still could get it, even if you are fully vaccinated. Additionally, if we have so many people who refuse to wear masks, that it would be one more reason not to. They could say, it doesn't, I've been vaccinated, so people are running around without masks. It gets too confusing. We need to send a message that they're still really important. If I already had COVID-19, why should I get the vaccine? We don't know how long the COVID-19 immunity will last. We don't know that you can't get it again. It's important to get the vaccine to cover in those instances. I know that I said that we think it lasts 8 months, and that's probably the case, but it's still important to cover because we still do not have enough proof on any of these answers. Should employees who have had both COVID-19 vaccines still quarantine? We answered that. No, you don't need to if you've been fully vaccinated. This question simply says vaccines in children. Can you elaborate on this topic and touch on any common concerns you've heard about vaccines in children? I'm actually been approached by Mrna from a faculty member, one of my colleagues at the University of Minnesota, who's hoping to be able to start testing the vaccine on children ages 6 months to 12 years, I believe. I think it's that age. But they are in phase 3, meaning that they've already tested in other groups how much of the vaccine should be used. It's much further along they're on the last stage of that trial, so we won't be first in line. Can you discuss what the vaccine is made of? We talked about that. I showed the ingredients list and how were the vaccines developed so quickly. It's true, they were, but if you think about the capacity, all the scientists in the world, and particularly the scientists at the highest paid institutes in the world, and what they're capable of doing if they apply themselves 24/7 as they did, I think the bigger question is, why are these vaccines not available for everyone? Why is there a market on a vaccine that protects the world? But that's just my 2 cents. Vaccines were developed quickly, but only because we were in a pandemic that was infecting millions of people. We know these vaccines have also been tested more than any other vaccine in history. I also think it's helpful to know that our African-American brothers and sisters, scientists and physicians, know that in their communities, the mistrust is as high as in our Native communities, and that they need to feel safe themselves to be given this vaccine. So they have been testing right alongside the government scientists to make sure that this vaccine is safe. I think that answers it. So let me quit my slide presentation. I think I just stopped share. There we go. Should we start answering some questions?
Yeah, that would be great. So Dr. Owen, first off, thank you so much for sharing all this information and your knowledge with us. And thank you to those attendees who submitted those questions in advance during the registration process. It's great to hear those questions up front to know what your main concerns are. So we have about 20 minutes left. And so we want to open up the space for any live questions and comments from attendees. So as you mentioned at the start of this event, you can share comments or questions online through the chat or the Q&A box on your screen. Or if you prefer to share out loud, you can do that by pressing the raise hand button on your computer or using *9 if you're on the phone. So Dr. Owen, let's start off with one of the questions that was submitted. So it asks, is the mRNA in the vaccines very sensitive, so much to want to avoid tapping syringes to get the bubbles out, or to get out bubbles?
That's an excellent question. I know there are instructions on how to give it, and I can look that up and answer you later. I don't give the vaccine myself, so I don't know that the answer to that question. I'm curious if the person is a nurse working in our systems and that's why they want to know, or what the thought is, and what the concern is too. But I can send around the, on the CDC, they have the webs, they also have the information on exactly how to give each of the different vaccines. You know, like Pfizer has to be stored in the cold until a certain amount of time. So good question.
Great, thank you. And then another question for you is, if I had a mild case of COVID-19 in the past, then are you going to be guaranteed to have mild symptoms in the future if you got another infection?
Well, that'd be, I think you're probably thinking that if you got the vaccine and you have milder infections, most likely going to be the case. And I think that'll depend on the individual too, though. If you're a person who's immunocompromised, then it's still going to hit you hard. Or if you have any of those high risk factors that we've seen people be hit with or hit harder with, for instance, heart disease, overweight, and then you're still probably going to get hit hard. I'm always curious about what the intent is behind the question, what else is being asked. But so if I didn't get to it, please follow up and let me know.
Sounds great, thank you. And so another question that we have for you is, does breastfeeding protect a baby from COVID-19 if the mom is fully vaccinated?
Great question. We know that the antibodies are being transferred through the breast milk. So assuming that some of that transfer of immunity is coming over, just as we see for other infections, and that moms, the benefits of breastfeeding once again.
Sounds great. And then, are there any considerations for people who maybe are planning to become pregnant soon, or any concerns that they have about fertility that they should be aware of if they're looking to get vaccinated?
No, there are no restrictions that I am aware of. If I find out I'm wrong, I will email you, but we know that pregnant women can get it, and it should not impair fertility.
Great. And then I saw another question come in, so let me. pull it up from the chat. So what are the chances that we will have another Moderna vaccine booster similar to the flu vaccine?
I don't know how to quantify that, but I would say good, because, well, for one thing, we know that the variants may pose an issue that not all of the vaccines can get to, right? Just like our flus change constantly, we think that it looks like the COVID virus is going to be a bit of a challenge that way as well. So without having any scientific data to back me up, I would just say the odds are high that we'll have to have boosters.
And then do you know if there's any sort of a timeline that's been released on when the boosters will become available, or is that still something that's to be determined?
Definitely to be determined. We still have a significant number, 200 million people to get vaccinated? No, 100 million people to get vaccinated. Yeah.
And is there any update on, or can you speak to at all, children in the vaccines? So when children would possibly be able to get vaccinated, or any other common questions that you've heard around that topic?
The latest that I've seen is that in the fall, we'll start to be able to vaccinate at least 12 to 16-year-olds, and I think younger beyond that, I believe. But that's part of the trials that are going on right now. I recall something that I wanted to mention is people think that there's a concern that we are being guinea pigged and that we got the vaccine so quickly as Native people. But in doing the research for this and another talk that I recently gave, that push to get us vaccinated early actually came from H1N1 when we died at 4 times the rate of other populations. People recognize, hey, wait a minute, these guys really need the protection sooner than others do because they're so much more impacted. So it wasn't COVID that caused that need or caused that recognition that we need to be vaccinated early. It was H1N1. And it's not, again, it's been tested so many ways and times more than any other vaccine. I think it's also telling that when we are thinking about this children's vaccine right now, the trial for the children's vaccine, it's doctors who want their kids immunized. They want to jump in line, and we have to say, no, we need to do it for the vulnerable populations first. So.
Thank you.
Yeah.
And then another question that we have for you is, why do some people have more side effects from the vaccines than others? So for example, if you don't have side effects, is that like a sign of a strong immune system, or is it like a sign that the vaccine didn't work? What can we learn from people's differences in terms of side effects?
No, I was hoping, had this macho belief because I had a pretty strong reaction myself that it was because I had such a strong immune system, but that has proven not to be the case. We don't know why some people, we do know that people, I'm dropping my thought now. I just read about it in the English study yesterday, but no, there's no proof, and we don't have any solid evidence one way or another of why some people get it so much more. I think it's really important to emphasize, though, that we do know that it is the immune system and not people actually getting sick from the virus, which fortunately people are seeming to understand now. It's just our immune system gearing up, but you can't tell. You can't tell.
Thank you for that.
Mm-hmm.
And then, so if somebody has someone who's, like, for example, their grandparent, and they're both fully vaccinated, the person and their grandparent, but there's still some worries about seeing each other in person, is that really a safe setting, or should there be any concerns if you have two people who are fully vaccinated, but especially after being isolated and following the guidelines so long, if they still have some concerns? Is that substantiated, or should they be fine in that scenario?
So if I'm hearing this right, and correct me if I'm wrong, if grandma and grandpa are fully vaccinated, living in their own home, then, and you're fully vaccinated, there's no reason you can't go in and visit them without masks even. Unless they are immunocompromised or they're particularly frail, then you probably still want to wear your mask. But you can now visit them if everybody's fully vaccinated. Does that answer it, or was there a variable I missed?
Yes. Yep. That hit on the main question behind.
Okay. And remember, people are even more free to meet outside, and it's probably good for people right now to be outside and benefiting from our natural air. You can meet outside more easily and have less risk.
Great. Thank you so much.
Mhm.
So the next question that we have for you is, what are the long-term effects of the vaccine versus the long-term effects of not receiving the vaccine and having COVID-19?
Both are unknown. We do know that there's something called long face? I can't remember the term, but we're seeing effects from the vaccine or from the COVID virus far out, including strange things like clots, like cerebral aneurysms, like vascular problems, meaning the vessels and anywhere in your body are inflamed, things that we wouldn't expect. It's a very strange virus that way, has been from the beginning. So jury is definitely out on that. Vaccine, we also have, again, only tested for 3 months, and now maybe, what are we? We're month 4, maybe 4 months, 5 months out at most from the vaccine. So we don't know. So far, it's been safe. We certainly haven't seen any of the problems anywhere close to what the virus can do to us. So, it seems pretty obvious that you're much better off getting the vaccine. And again, those are pretty benign components that are in those that ingredient list.
Great, thank you. And so we do have another question. Are there any associations/correlations with blood types and COVID-19?
I did see that come up in the news, and I can't recall the answer to that one. Like some people I'm going to say it wrong. So I'm sorry, you're going to have to Google that one. I can't recall the answer to that one. Maybe, do you guys know from your work at Glitech? I guess not. Okay, next.
To say I'm not aware, and from the silence from my coworkers, I don't believe they know as well.
I'm sorry to dump that on you guys. I know that I saw it and I just can't pull it up to the top of my head, probably also because I'm giving this presentation.
No, it's a good question. It stumped everyone here. And if anyone else, we encourage you during this time to submit any questions that you guys have, either through the chat or Q&A. And then there's also the option to ask questions live if you have a preference for that. So
I will give you, if there are other more questions.
Mhm.
Okay,
Go ahead, Dr. Owen.
Oh, no, you go. Those questions are more important.
Okay. So one of the questions that we had for you is, so if I'm young and I'm healthy, why is it so important to get the vaccine versus getting sick naturally?
Getting sick naturally, even though you're young and healthy, doesn't mean that you're not going to have one of those strange effects, long-term effects of the COVID virus. We don't know all that it can do. We only know what we're starting to see. There's something called an inflammatory MIS, I believe, multi-system inflammatory disease, system disease in young people. So pediatric patients that can come on long after they've been infected, and it basically affects the different organs in their systems through the vascular system, the blood vessels. So we don't know that just because you're young and healthy that you won't be impacted long-term from it. And that's number one. Number two is, if you get it, you can spread it to others. So I think people misconstrue this idea that's really important, that one of the key reasons to get the vaccine is to protect the people around us so that we don't spread it. It's just with the mask. You're not wearing the mask necessarily for yourself. You're wearing it so that you don't spread this infection to other people as well.
Great. And so is another one of the key reasons for getting the vaccine specifically because of the different variants that are coming up as well?
Yeah, well, it's all of it, right? But if we get the vaccine now, we help decrease the spread of the variants. The sooner that we stop this COVID virus from mingling, hanging out, and giving it more opportunity to reframe its genetic code, the sooner we are going to stop these variants, right, and the continued spread.
Great. And then another question for you. If you have received the first of a 2-dose vaccine and then you get COVID in between the 2 doses, should you still get the second shot?
Yes, but you have to ask about the timing. So you'll have to talk to your healthcare providers about when you get that second shot. And that reminds me that I also forgot to say that you are not fully protected until 2 weeks after the second shot. So no celebrating until then. But When you need to get your second following an infection is going to be, your clinic can tell you the specifics on that.
Great. And then the last question that I have for you, and obviously anyone who still has a question on their mind, please place it in the chat or use the raise hand icon to ask it over the computer, or use *9 if you're on the phone. But the last question that we have for you is, trying to convince a family member to get vaccinated. What are some of the big benefits of the vaccine or suggestions that you have to try and convince them to get vaccinated?
I wish I knew what they'd already tried, but the things that I use are, one, that we're doing this for our community. And number two, you're helping spread. In doing so for your community, you're helping stop the spread of the variants, which will continue this pandemic, which keeps us inside our houses so we can't interact. The sooner we get this under control, the sooner we can go back to normal life, all of us. Because the federal government, no leaders are going to allow us to go back if the pandemic is still raging. So presumably most people want to get back to their normal lives. That's a big one for me. The other one is how many people in our communities have been impacted. Finally, or not finally, but another one is we don't know the long-term effects of COVID-19. It might seem like some people got away without being heavily impacted by it, while others we don't know because we're not in contact with everybody who's been impacted by it. Those are the main reasons that I would use.
Great. Thank you, Dr. Owen.
Yes.
And so those are the questions that we have in the chat and the Q&A right now. We'll continue to monitor it if anybody thinks of anything before we close this. But I know you had mentioned that you might have something today to say. Do you have any final remarks that you'd like to share with us before we go into our closing?
There is another question. Could you clarify whether you can infect someone else with MIS? I think you went from talking about MIS to protecting others by wearing a mask, explaining that you can infect others with the virus. MIS itself is not contagious. That is correct. MIS is just an expression of the infection. So some people get an infection that's so bad that it infects their inflammatory system and causes them to be ill all over. But it means that if usually people get MIS after they have been infected, so they're no longer infectious. But until you know that, they definitely need to be out of range of other folks, which they probably are, because if they have MIS, they're quite sick. Good question. Sorry, sometimes I jump around a lot. Well, hey, Brett, Dr. Thompson.
Thank you for catching that. That just came into the chat.
Sure.
Great. So then I just wanted to turn it back to you. Do you have any final thoughts you'd like to share or information that you'd like to make sure that you cover before we go into a closing here?
One of the problems that I face with oftentimes in public, and I think Dr. Thompson can back this up, is that some folks don't understand where to go to find good information. They want to learn as much as they can about illness, but there are a couple of good sites. One is familydoctor.org. The other obviously is the CDC, that I would go to the CDC first. IHS.gov has some information on it, but mostly the CDC. Mayo.org has good information. And again, AmericanFamilyPractice.org has good information. And if you don't like any of those sites, then ask your doctor. But I would ask you to, go do exactly like those who came here today did. Come to these talks and ask the questions that you have before being frightened by something that you read on the internet, or ask your doctor. And thank you, Glitech, for having this talk today. It's so important.
Yeah, well, and thank you for all the knowledge and wisdom that you've been able to share with us as well. So with that, I think we will close our Q&A. And so thank you again to everyone who submitted questions. We really appreciate the involvement and active participation with this topic. And so with permission from Dr. Owen, we will be sending out a recording of this presentation. So we encourage you to please share this recording with others who would benefit from it to help empower them to make an informed decision about the vaccines. So the email that we'll send out with that recording will also have a link to the event feedback survey. That link is also on the current slide. So if you have a few minutes either now or later to complete that survey, it is appreciated. We'll be using that feedback to better serve you and your community in the future. And by completing that survey before Thursday, May 6th, you may enter yourself for a chance to win a $25 gift card as a small way for us to say thank you for your time and your insights. Finally, if there are any questions about this presentation, please use the contact information on the slide to contact myself, Julie Nystrom, or one of my coworkers. So with that, thank you everyone and have a great afternoon.